Hi, my name is Terry Buchanan. I'm a nurse practitioner student at Maryville University, and this is my head-to-toe assessment. Chris, come on in. Chris has agreed to be my patient today. You want to start with just a general inspection. When he walks into the room, he's got a good gait. He's not unsteady. Prior to the video, I asked Chris to empty his bladder. We did a full set of vital signs, including his height and weight. We checked his near vision with the Rosenbaum chart and his distant vision with the Snelling chart. And I've washed my hands and we're ready to begin the exam. You just want to start with the general inspection of his face and head, looking at the eyes and ears to make sure, looking at the placement, they're symmetric. Looking at the scalp for any lesions or masses. You want to palpate the scalp from front to back, making sure it's normal cephalic. Noting any bulging areas of tenderness, depressions, or lesions. You want to look at the hair distribution. Chris has a little bit of receding hairline. You want to palpate the hair. It's nice and soft. The hair follicles are not easily removed when you run your fingers through the hair. The next thing we're going to, and there's no areas of alopecia. The next thing we're going to do is palpate some facial bones. I'm going to palpate the lacrimal apparatus. Let me know if there's any tenderness. Palpate the frontal sinuses and the mandibular, or the maxillary sinuses. Any tenderness with that?
No.
Okay, the next thing we're going to do is palpate the temporomandibular joint, open and close. One more time. Noting any popping or clicking. Any pain when you open and close your mouth?
No.
Okay. Next thing we're going to do is light sensation. Chris, if you could close your eyes and let me know if you feel the sensation equally on both sides of your face. The forehead,
Yes.
cheeks,
Yes.
and the chin.
Yes.
Next thing we're going to do is I'm going to have Chris put his face through a series of motions to test his cranial nerves and motor function. If you could clench your teeth, wrinkle your forehead, close your eyes shut real tight, open, puff out your cheeks, stick out your tongue, and smile. Great, and his cranial nerves are intact. The next thing we want to do is look at his eyes again, looking to see that they're symmetric, looking at the eyebrow hair distribution, they're nice and full, his eyelashes extend outward. You want to inspect the sclera, which is nice and white, and the conjunctiva, which is moist and pink. The next thing we're going to do is some eye exams. The first thing we're going to do is check his pupillary response. So if you could just pick a spot on the wall, and we're going to check the direct and consensual, and then again the direct and consensual. Next we're going to do the cover-uncover test. Again, just pick a spot on the wall. Cover your right eye. While Chris is doing that, you're looking for any extraocular movements, any jerking, or nystagma or twitching. Cover the other eye. Great, none was noted. The next thing we're going to do is the cardinal field of vision. Chris, I want you to follow my pen light with your eyes, not moving your head. And again, while Chris is doing this, we're looking at his eye movement, making sure that there's no extra ocular eye movement, no nystagma, jerking or twitching, and no conversion. The next test we're going to do is the field of vision. So Chris, I want you to cover your right eye and let me know when you see my fingers come into your field of vision.
No. No.
Cover your other eye.
No. No.
Great. The next thing we're going to do is move on to the ears. Again, looking to make sure that the ears are symmetric. You want to palpate the auricle for any lesions or masses, and if there's any pain when you pull up on the pinna. Any pain with that?
No.
Okay, great. Next, we're going to move on to the hearing test. Chris, I want you to cover your right ear and let me know what word you hear me say.
Apple.
Other ear?
Orange.
Great. The next thing we're going to do is the rhyme test, and this is to test air to bone conduction. I'm going to strike the tuning fork and place it on the mastoid process. And when I move, I want you to let me know when you quit hearing the sound, okay? So we're going to strike it, place it on the mastoid process. Let me know when you don't hear the sound anymore.
No.
Moving it to the auditory canal, and let me know when you don't hear the sound anymore.
No.
Checking the other side, placing it on the mastoid process.
No.
Moving it to the auditory canal.
No.
And noting that the air to bone conduction is twice as long, which is a normal finding. The next thing we're going to do is move on to the nose. You're going to look to make sure that the nose is midline. You're going to inspect the internal structures, making sure that the nasal mucosa is pink and moist, or it's just pink, it's not moist. That the turbinates are firm, hair distribution in the vestibules is even, and the septum is midline. Next, we're going to check for patency. So if you could occlude your right nostril and breathe in. Other nostril, breathe in. Any problems with that?
No.
Great. Next, we're going to move on to the lips. The lips are pink and moist. No areas of cracks or fissures. If you could open and say ah. The uvula rises and falls when he says ah. Open one more time. You want to inspect the buccal mucosa. It's moist and pink. The hard and soft palates are soft and contiguous. The posterior pharynx is moist and pink. Say ah one more time. Noting that the tonsils, the anterior and posterior pillars are visible. The tongue is sleek and moist. It's a deep dull red in color. The gums are non-receding, not bleeding, non-inflamed. Chris has 28 teeth. They're white in color, and no mouth odor is noted. Oh, lift up your tongue. Let me look at the floor of your mouth. The Wharton ducts are bilateral and patent. The next thing we're going to do is check for gag reflex. If you could open. And it is positive. The next thing we're going to do is look at the neck. The neck is smooth and sleek. I don't see any JVD. There's no obvious masses or thyroid goiter. You want to look at the trachea, make sure it's midline. You can palpate, know that it's not deviated to the right or left. Go ahead and swallow for me, Chris. The cartilage moves when he swallows. We're going to palpate the thyroid gland by moving the trachea just a little to the left. And swallow one more time, Chris. Okay, great. The thyroid gland was firm. No nodules or lesions were noted. The next thing I'm going to do is palpate the carotid arteries, one at a time, noting the amplitude and intensity. The next thing we're going to do is auscultate the carotid arteries with the bell of my stethoscope. Hold your breath for a moment, Chris. Breathe. Hold your breath. Breathe. And then auscultating the thyroid. You're listening for any extra sounds such as a brewery. And none were heard. Okay, next I'm going to have you do some range of motion. I want you to put your right ear to your shoulder, left ear to your shoulder. Extend your head back, touch your chin to your chest, and shrug your shoulders. We're going to do this again with some resistance with my hand. So right ear to your shoulder, left ear to your shoulder, head back, head forward, and shrug your shoulders. Okay, great. We're also going to test his arm strength, so if you could go ahead and put your arms out to your side and resist when I push down. Okay, great. Out in front. Again, resist. Excellent. Good muscle tone and strength. Next thing we're going to do is inspect the shoulders, arms, and hands. Looking at the skin, it's nice and warm. He does have some freckling at the sun-exposed skin. His temperature is warm. He's got good muscle tone. Hair distribution on his arm is nice and even. You want to look at his fingers. There's no clubbing of the fingers. The nails are white. They're not cyanotic. Capillary refill is less than 3. You want to palpate the brachial pulses, again noting the intensity and amplitude. The radial pulses, again noting the intensity and amplitude. Great, and you're a 2+. Chris, if you could go ahead and turn for me. I'm going to look at your posterior chest. Again, you want to look at the skin. He does have some freckling at the sun-exposed areas. It's intact. There's no skin tears or lesions. Temperature is warm to touch. You want to note his respirations. They're even and unlabored in approximately 18. The next thing you want to do is look at the anterior to posterior configuration, which is 1 to 2, which is a normal finding. The next thing we're going to do is palpate for tactile fremitus. So, Chris, when I place my hands on you, just say 99.
99, 99, 99, 99, 99.
And what we're doing is we're checking for any lung consolidation. So I'm going to use the ulnar aspect of my hand and again say 99.
99, 99, 99, 99.
Okay, great. Next, I'm going to palpate for expansion. You want to place your hands at about the 9th or 10th rib. Take a deep breath in, Chris, and exhale. One more time. Great. And it is symmetric. Next, I'm going to percuss in between the intercostal spaces, noting any resonant sound. And again, this would indicate any lung consolidation. Okay, next I'm going to measure the diaphragmatic excursion. So if you could cross your arms in front of you and lean forward just slightly. You want to palpate from the scapular line down, noting the sound change. From resident to dull. So Chris, take in a deep breath and hold. And you want to mark that spot. Go ahead and breathe. Okay, take a couple of breaths. And then on the next breath, take a deep breath in and hold. And you want to percuss up. Again, noting the sound. Great. And then you would measure that area, which is about 4 centimeters. The normal is 3 to 5. Next, I'm going to auscultate the posterior chest. Chris, you can sit up. I'm going to auscultate the posterior chest, all lung fields. So just take some slow, deep breaths for me, Chris. Moving systematically through the lungs. If If you could raise your arms, I want to listen to the lateral sides of the chest and compare. Again, slow, deep breaths. And again, you're listening for any adventitious breath sounds. Put your arms down. And there were no adventitious breath sounds in the posterior or lateral chest. Okay, Chris, you can go ahead and turn back around. Okay, we're going to inspect the anterior chest again, looking at the skin. He's got some freckling to the sun-exposed areas. The skin is nice and warm. Measuring his respirations, they're even and unlabored and approximately 18. No accessory muscles are used, no nasal flaring. We're going to palpate the posterior chest for any tenderness, masses, or lesions. Any tenderness?
No.
Okay, we're going to palpate the infraclavicular nodes. Lift your arms a little, and the axillary nodes. Okay, lift your arms down. Next, we're going to percuss again the intercostal spaces, noting any resonant sound that would indicate lung consolidation. Next, I'm going to auscultate first with the diaphragm of my stethoscope, listening at the aortic, the pulmonic, Erb's point, the tricuspid, and the mitral. We're listening for any extra sounds, clicking, or murmurs. And none was noted. We're going to listen again with the bell of the stethoscope at the same points. The apical, the pulmonic, Erb's point, the tricuspid, and the mitral. You want to inspect the pericardium, noting any heaves, lifts, or extra pulsations. None are seen. You want to palpate at the apex, the left sternal border, the base, and the apical. And you're allowing the cardiac movement to rise and fall to your hand, noting any lifts, thrills, or pulsations, and none was noted. I can't remember if I did tactile form test. Next, I'm going to have you lay on your left side, facing me, and I'm going to listen to those sounds one more time. Again, at the apical, the pulmonic, Erb's point, the tricuspid, and the mitral. Okay, go ahead and sit up. And no extra sounds were heard. Next, I'm going to go ahead and lay down. I'm going to inspect the abdomen. You want to look at the abdomen. You want to look at the contour. It's nice and flat. You want to use tangible lighting to look for any bulging or pulsations or any extra abdominal movement. None is noted. You want to palpate the aortic area for any thrills, lifts, or pulsations. None is noted. I'm going to auscultate for bowel sounds. diaphragm of my stethoscope. You want to start in the right lower quadrant, listening for 2 minutes. You want to listen for the intensity and pitch. And you may have to listen for up to 5 minutes, and you want to move systematically through each quadrant. Next, I'm going to auscultate the aorta with the bell of my stethoscope. You want to listen for the right renal artery, the left renal artery, the left iliac artery, the right iliac artery, the right femoral artery, and the left femoral artery. And no bruise or hurt. Next, we're going to do some light palpation in each quadrant. Chris, let me know if you have any tenderness. Any tenderness with that?
No.
Next, we're going to do some deep palpation. And again, let me know if you have any tenderness. Any tenderness with that?
No.
Okay, next we're going to measure the liver border, and you're going to palpate from the right mid-clavicular line. Chris, take a deep breath in, noting the resonant sound change from resonant to dullness, and marking that spot. Breathe. Take a couple of deep breaths. On the next breath, hold, and you want to percuss up. Again, noting the sound change, and you want to measure that spot. And you would measure, and that's approximately 4 inches, and normal is 3 to 5. Next, if you could turn towards me just a little bit, you want to palpate this spleen area, and you want to palpate on the left mid-clavicular line, noting sound changes at between the 6th and 10th rib, and that would, the dullness you will hear in the sound change will indicate where the spleen is. So Chris, take a deep breath in and hold. And you want to mark that spot. Go ahead and breathe. And on your next breath, take a deep breath in and hold. And again, you want to percuss up. Great, and I'm right here. And so his spleen, the dullness was heard in between the 6th and 10th rib. Okay, you can go ahead and lay on your back again. We're going to palpate bimanually the liver border. And the right kidney. And then the splenic area, you cannot palpate the spleen. And then the left kidney. Any tenderness with any of that?
No.
Okay, great. You go ahead and sit up. Next, we're going to test your reflexes. Go ahead and put your arms out this way. We're going to do the brachial, the radial, the popliteal, the Achilles. Okay, great. Next, we're going to inspect the legs. You're again looking at the muscle tone. The skin is intact. There's no lesions or skin tears or freckling to the sun exposed areas. Hair distribution on the legs is even. They're warm to touch. You want to palpate for any edema. No edema is noted. You want to look at the toenails. They're intact, they're white, they're not yellow or cyanotic. Capillary refill is less than 3. You want to palpate the pulses, the popliteal pulses, again noting the amplitude and intensity. The posterior tibia pulses, again noting the amplitude and intensity. And the dorsalis pedis, again noting the amplitude and intensity. And they're 2+. Okay, Chris, if you want to go ahead and stand up for me. Turn just a little. I'm going to palpate your spine here and let me know if you have any tenderness. Any tenderness with that?
No.
Okay, lean forward for me a little bit. Great, noting his spine for any kyphosis or scoliosis, and none was noted. Okay, Chris, you can go ahead and have a seat on the table. I think that concludes our exam, and thank you for being my patient today.